Contrary to what your mom or grandma might have told you as a kid, it takes a whole lot more than a glass of milk to keep strong and healthy bones, especially if you're an aging adult or an active athlete who's suffered an injury or two or three.
Or four or five. Sometimes it takes surgery, rehab, and a team of experienced medical experts to get you back in top shape. A team like our guests today, Dr. John Ellis and Dr. Sean Griffin from Ellis and Badenhausen, Louisville's leader in orthopedics and sports medicine. Welcome, doctors. I know you're new to the practice, Dr. Griffin, but Dr. Ellis, let's start with you. Your family has been involved in this industry for a long time, and I mean, local legends. I'm just going to say that.
Well, thank you for that, and it's due to my father's reputation and starting a practice in the early 50s.
Right, the legendary Rudy Ellis,
Correct.
Football player, superstar, met your mama here, a nurse, fell in love, and made you.
Terry knows the whole story.
I know the whole family.
I love it.
Yes, and that's kind of how it all happened.
But you guys are, I mean, primarily, you help U of L, I guess you help soccer squad, you help a lot of the various athletic teams.
Probably best known for that, but also my dad and Dr. Badenhausen were the team doctors for the Kentucky Colonels professional team.
Fantastic.
And they also do Bellarmine, and for a while we had one of our partners who's now retired, Dr. Mark Petrick. It was a Bellarmine graduate, and his father was the president of Bellarmine for a while too, so we have a long connection with Bellarmine.
Sean, I hear you guys have like a walk-in clinic on Mondays. This is for weekend warriors. Is that what that's about?
We do, yeah. So starting February 1st, I came on board with the group. Really a tremendous honor to be part of this group, very well established. Fantastic group of doctors and staff, and I'm really honored to be a part of it. Part of my clinic schedule is that we have a good partnership with Norton Healthcare, and we are now a full-time presence on the Norton Women and Children's Hospital campus. As part of that, I will be in clinic for a standard clinic day every Monday, and that clinic will be open to walk-ins from ER visits, from injuries over the weekend.
Yeah, because you're training for a marathon, twist an ankle, and it's like, right. And they hobble in on Monday morning.
Yeah.
You also specialize, though, in total joint replacement, and as we were talking about in the beginning, I mean, you brought some props to help show us what you can do.
So, first of all, arthritis, when you think of orthopedic surgery, you think of broken bones, you think of arthritis. Right. And arthritis is the #1 cause of disability in the United States. Okay, it affects 50 million Americans to some degree. About 28 million of those are adults suffering from osteoarthritis, which is the most common type of arthritis.
And what is arthritis?
So
just simplified.
Yeah, so arthritis is wear and tear, inflammation, and breakdown of the joints, okay? It does occur as a natural process, but there are certain factors that can influence it. Primarily when you think of arthritis and what we would be seeing you for are hip and knee arthritis, which are two of the most common major joints affected in the lower extremities.
So you have a hip set up there.
So this is what a pelvis would look like. Okay, pelvis is kind of a ring-shaped bone. I'll draw attention to what the hip socket actually is. The hip is a ball and socket joint.
Okay.
And that just gives out after so long of wear and tear of just living your life, right?
Yeah. So the socket is actually called the acetabulum. It is part of the pelvis. The ball is called the femoral head. It's the top part of the femur. And typically, the ends of the socket are coated in cartilage, which is a thick, spongy, protective substance for the ends of the bones. You find it in all the major joints in the body.
Okay, so but you can treat all that difficulty and then hip replacements, essentially.
Yeah. So when it comes to arthritis, people who suffer from arthritis typically have pain and disability. There are a number of treatments. Most of those are non-operative, such as therapy, injections, anti-inflammatory medications. When those no longer work, when the arthritis becomes severe enough, that's when we discuss joint replacement. And joint replacement is a resurfacing procedure where you're actually removing and replacing the diseased surfaces of that joint. For the hip, it would be the ball and the socket. And I actually brought along what a hip replacement looks like.
Oh, yeah. That gets the job done and brings newfound love of living for a lot of folks.
Absolutely.
Appreciate that. Nice reflection of the table off of that. Thank you, Sean. We appreciate it, John. It is great to see you. Love to the family as always. Keep up the good work and welcome to the team. If you're interested in learning more about Ellis and Badenhausen Orthopedics, you can reach them online at eandbortho.com.
Or just give them a call at 587-1236.